Tucked away in the corner of this science lab, a small, familiar-looking device makes a few quick passes over a glass slide. It might not look impressive, but what just happened is groundbreaking. Instead of ink coming from that printer cartridge, it was living human cells.
I thought it's revolutionary.
Boland, along with Laura Bosworth, co-founded the company TeVido Biodevices 3 years ago. For Bosworth, the fascination with 3D printing began as soon as she met Boland at UTEP.
He showed me what he was doing with the printing, and he had some ideas about how he could use it in wound care.
With 3D printing, you can just go layer by layer, and so if you need a layer with channels for blood flow, you can design that into your system.
Boland is known as the grandfather of 3D printing, holding one of the first patents for printing with living human cells. TeVido looked at the current market for 3D printing in the medical field. Several companies were already working with skin grafts, which seemed like a natural place to start because 3D printed cells are arranged in layers.
We had a couple of plastic surgeons brainstorm with us, and they said, well, breast reconstruction is very problematic, and do you think you could work with fat cells instead of skin cells? And we're like, why not?
Using fat cells gives TeVido an advantage. The cells aren't as complex as ones from organs, which need to sustain life. And by focusing specifically on breast reconstruction for cancer survivors, TeVido has isolated an important but often overlooked area of reconstructive medicine. More than 60% of women diagnosed with breast cancer in the United States opt for lumpectomies.
There's a great deal of disfigurement that can occur. One woman who said, I went through 15 surgeries in 8 years. You've already gone through this potentially life-threatening event. You've come out on the other side and you're a survivor, yet every time you look at yourself in a mirror, you're reminded. So yes, it is frequently said, oh, that's just cosmetic, but it's far, far deeper emotionally than just cosmetic.
The precision of the 3D printing allows Boland and his team to create the shape. It also allows them to print the cells in thin layers that encourage blood flow, essentially creating vessels within the printed implant that will greatly increase the chance of success within the patient. And by using the patient's own cells, the chances of rejection by the body are dramatically reduced. True impact.
What we want to do ultimately is help patients. Help patients that have a diseased or non-functioning tissue or organ. And that's the ultimate goal. If you could have some patients there, then that would be terrific for 3D printing.